Chapter 4, July 31st, 2018. The Right to Life and Healthcare. We the people have the enshrined rights to life, liberty, and the pursuit of happiness, which by natural extension includes your right to your property and physical person. We agree to these words as inalterably written down, but disagree as to the meanings of life and liberty and happiness and even pursuit. The idea of the founders was an expanding concept that would increase the well-being and freedoms of Americans. So in exact opposition to the principles we must commit to stand on is this unusual and perverse argument that we should minimize and cage these words. The wheels begin to be spun, and we get confused where the line should lie in order to honor our pledged values, but validate our own feelings of inadequacy and insecurity, as necessary sacrifices should therefore be the standard. We need to give meaning to our suffering as we hear venom spewing from the mouths of those of privilege or power, or as most common, both, and we accept any deviation from the expected punishments will collapse the system, and the consequences uniquely visited only upon us, the powerless and disadvantaged, because that is the lifelong message we have been forced to swallow. Have we forgotten this is a democracy, formed for the sole purpose of improving the American people? What is amiss that you cannot conceive of the vast depths of benefits these words promise? How does it disadvantage you to refrain from judging your fellow men and women, imposing valuations based on suspect information and loose reasoning, if every person, including you, would be better off to relinquish once and for all to the desirability and wisdom of equal for all as a matter of common belief and sense? Free yourself by letting go of your biases. Liberate your potential by embracing and fighting for your own. Do not believe the lie that any person is less than a person, and thus relieve your own fears that you may be treated as less. Examine what you actually know and have not been told by another, to what you most believe. If you were given access to resources that have been denied you, would you be in a different place? If you had enough money for food, healthcare, education, time for your family and personal interests, mental health services, if you have not had these things all your life, do not resign yourself to the fairness of these burdens because of a perceived loss from missed opportunities, real or imagined, for you. Why should only the wealthy have control over these industries so necessary to the quality of life? I ask you to control your own truths and open your own eyes. You have not failed. Opportunity could be shared across all of us, but has been manipulated and stolen from you by those with power, not the powerless others they set you against. I say we have a right to life-saving treatment, a right to liberty from communicable and preventable disease, and a right to pursue our individual health needs as we see fit without judgment, interference, or invasions of privacy. Rights are not given, they are demanded from our governments, earned both through vigilance and setting the boundaries of human decency for ourselves. We set the minimum levels of acceptable equality in total disservice to ourselves. If you're an American, you either pay dearly if you try to access any of these things or are denied altogether as things stand today. Your money and time goes to insurers and drug companies who offer nothing except gambling on the odds everyone gets sick and dies. They are the house and will always win if you continue to throw your money at it endlessly. Give your money to the government through taxes and they will definitely pay your doctor. It's not magic, it's economics, and we continue to indulge in an archaic system of greedy middlemen when technology has eliminated their need. We have a health provider shortage. Get out of insurance, go to school, join the actual health industry, and save people's lives. Tell me, are you so selflessly committed to private accumulation of wealth that you are willing to die on the doorstep of a hospital? If life so happens at the wrong moment, determined solely by a nameless, faceless bureaucrat signing your death sentence with a denied rubber stamp, so convicted that millions of children must die with you to vindicate your blind self-sacrifice, that their little lives and families are damned to teeter in insecurity, afraid their precious potential will be extinguished by the choices of strangers, not their actual possible chance of survival. What do you gain from inhibiting others the means necessary to survive or demanding way of life? What injury if parents make the difficult decision to terminate a pregnancy without your pre-held generic judgment of their intimate and private reasons, which you cannot and should not have any knowledge of? We generally agree we cannot tell a man he must sacrifice his wife for a questionable pregnancy, but who are we to say what sacrifices are acceptable, what problems are sufficiently terrible to spare a child inestimable suffering just by opening its eyes to this world? The life we live, the lives for which we are responsible, are vulnerable to the systems in place that are duty-bound to serve us, yet ignore and marginalize our needs in service to theirs. If you want to help parents bring children into this world, stop trying to control their right as parents to decide what's best for their families and instead ensure their children and they have the ability to truly live, not just be born. Been all of us, but has been manipulated and stolen from you by those with power, not the powerlessness. We have a health provider shortage. We have a health provider